Welcome to the meeting of Assembly Committee on Education for the 2023 legislative session. Secretary, will you please call the roll?
Assemblywoman Anderson.
Present.
Assemblyman De Silva.
Here.
Assemblywoman Hanson.
Here.
Assemblywoman Hardy. Assemblyman Koenig.
Here.
Assemblywoman LaRue Hatch.
Here.
Assemblyman MacArthur.
Here.
Assemblywoman Mosca.
Here.
Assemblywoman Taylor.
Present.
Assemblywoman Thomas.
Here.
Assemblywoman Torres.
Here.
Chair Bilbray Axelrod.
Here, and please mark Assemblywoman Hardy excused. She'll be here shortly. And present when she arrives. That's what I meant to say. We do have a quorum. Welcome to everyone in Carson City. We have a full house today. Nice to see everyone. Those joining via video and anyone who might be in Las Vegas. Just housekeeping, remember to silence your cell phones. I always just make sure, double check. Anything that makes any sort of noise, go ahead and silence that. If you wish to testify, please sign in at the table by the door and provide a business card to our committee secretary. When testifying, please turn on the microphone and clearly state your name, any affiliation for the record, then turn the microphone off each time you are speaking. Feel free, COVID restrictions are over, so if you're coming up to testify in support or opposition or neutral, we can fill up those chairs down there and just go. Each person, when a chair opens up, come back. Next person comes up. Handouts, there should be 20 hard copies for members of the public. Electronic copies should have been submitted to our committee manager by 1:30 yesterday. We expect courtesy and respect in this committee. Just also know that committee members will be using their laptops to view handouts and other documentation, also to communicate with me to let me know they have questions. Please don't view this as a sign of disrespect or inattention. With that, let's get started. Today we're going to hear two bills and a presentation. We are going to begin with a hearing for AB 43. Then we will hear a presentation from the Nevada Health Service Corps, and then we'll do AB 69. So with that, I'm going to open the hearing on Assembly Bill 43. This measure revises provisions relating to school emergency operation plans. To present this measure, we have representatives from the Division of Emergency Management of the Office of the Military. Please begin when you're ready.
Good afternoon, Madam Chair, committee members, and guests. For the record, I am Megan Hall, and I am the Planning Supervisor with the Nevada Division of Emergency Management and Homeland Security. I'm here to testify in support of Assembly Bill number 43. Assembly Bill 43 revises the deadlines related to the required submission of school emergency operations plans to the Division of Emergency Management as required by NRS 388-245, Section 3, and NRS 394-1688, Section 2. It also revises the deadline for which the Division of Emergency Management is required to submit a report to the Superintendent of Public Instruction as required by NRS 414-040, Section 5, subsection D5. These revisions add a specific deadline for submission of plans from Emergency Operations Plans Development Committees to their Board of Trustees or governing body on or before August 1st of each year. It changes the deadline for the submission of emergency operations plans from development committees to the division from July 1st to August 15th of each year. And it also revises the deadline for the division to the report to the Superintendent of Public Instruction from August 15th to November 15th of each year. The ideology of this recommendation was brought up by school emergency managers and was carried forward across the state and discussed with other local and county school officials. Discussions were also held across the educational sectors, including private, charter, and public schools. This change will have no impact on existing schools, both urban and rural, as they are always welcome to submit their plans before the deadline. This bill will allow new schools working through licensing and planning processes to have better access to required members of the Emergency Operations Plan Development Committee and school committees prior to the submissions deadline. These committees require members such as a minimum of one parent or guardian from the district and/or school to participate in the planning process. Changes to the deadline will also allow for the alignment of statutorily required plan submissions and reporting timeframes. The Division of Emergency Management receives plans from schools as well as jurisdictions, resorts, and utilities. For the 2022 calendar year, the division anticipated receiving 493 plans. Changing the date that the division is required to report to the Superintendent of Public Instruction to November 15th aligns the deadline with the resort submission deadline and allows the division to better streamline its processes for managing these duties. Thank you for your time, Madam Chair, committee members, and guests. I will take any questions that you may have, and we also have representatives from the Nevada Department of Education's Office for a Safe and Respectful Learning Environment to support answering any questions that you may have.
Thank you very much. And thank you for doing your due diligence and talking to people across the board. It seems like a pretty clean bill. I was not anticipating questions, but silly me. Assemblywoman Torres.
Thank you, Chair. I got 20 questions for you. No, I just do have I do have a couple. So my first question is so this would be like the emergency plan if there was like ever like can you give an example for like when this emergency plan might be used?
Megan Hall for the record. Thank you for your question. Chair Bill Bray Axelrod, through you to Assemblywoman, these emergency operations plans would be used anytime that a school or district would have a situation that constitutes an emergency. So these would be things as in fires on campuses. When we talk about lockdowns are included in these emergency operations plans, and those sort of actions help guide the tactics and the methods that they use to respond to those incidents.
Thank you. And my quick follow-up is just, wouldn't it make more sense for us to put like before the start of the school year? Because I would, as an educator, I would like my school to have that plan before the start of the school year, not before the 1st of August. Additionally, there's many states in the state of Nevada that start at different times. Some of our public charter schools do start as early, having staff in the building as early as the end of July. So I just think it might be better suited for us to have these plans in place at the beginning of the year and sent to all of these offices, because I would like for the Office of the Military to have that plan too by the time school year starts.
Megan Hall for the record. Thank you for your question again, and Chair Bill Bray Axelrod, through you to Assemblywoman Torres. It was discussed at length about where an appropriate date may be. With that said, this was the general consensus that came about and was agreed to upon by many of the people that we talked to and the majority of the schools that we spoke with. Again, this is geared more towards those new schools that are working through those planning and licensing processes. So if we set this a little too far forward, they may not have students registered at that point in time and may not be able to meet that requirement. And so that was the ideal behind this. With that said, as long as there's an alignment of how these processes are being carried out and when, and we're taking that stance of remembering that new schools have to comply with this as well, that was the goal of this.
And I'm sure to the chair's surprise, just very quickly. And so I just want to know, when in the planning process, what does this occur? Does this occur when the school is when they're about to construct the school, or is this occurring the same year that the school opens? Because at that point, they should already have students registered and classes made.
Megan Hall for the record. Thank you for your question. Chair Bill Bray Axelrod, through you to Assemblywoman Torres. With that said, I cannot speak to the timeline of how schools and districts plan. What I can say is the expectation is they will have a plan on record before they open their doors to students. Because as you said, it is a safety implication to have a school with anybody on campus that wouldn't have that plan. So yes, the ideal is every school will have a plan before students attend.
Assemblywoman Thomas.
Thank you, Madam Chair, and thank you for the presentation. I do appreciate the safety measures that we take for our schools and our students. Just question of clarification, about the end of your presentation, you had mentioned you've received 493 plans as of 2022. Are you missing any? Or, what is the requirement? How many should you receive? Thank you.
Thank you for the question, Assemblywoman Thomas. With that said, that 493 expected plans is across all required industry statutory required plan submissions, which has said utilities, jurisdictions, resorts, and schools. Of that, schools are 248 plans that we received for the year, and we did receive 100% of plans expected.
Thank you very much. Little known fact, actually, my very first bill was on this very subject back in 2017, so kind of full circle there. Okay, doesn't look like we have any other questions, so I will move to testimony. Unless you guys want to stay here and we can just open it up. Nice tie, by the way. I'm always a fan of the Nevada tartan. Okay, so if we have anybody here that would like to testify in support of AB 43? Please go ahead when you're ready.
Okay. Thank you, Madam Chair and members of the committee. For the record, my name is Mary Przynski, representing Nevada Association of School Superintendents, and our organization is composed of all 17 superintendents in the state, and we are in support of this important piece of legislation. And talking with some of our schools, for example, Carson City, they say we always have our plan in April, while we've been able to discuss with everybody. And so they are assured that their plan is in place when their students arrive. And I haven't surveyed all the schools, but I know that that is a fairly common practice. Thank you.
Thank you very much. Anybody else in support in Carson City? Okay, we'll move on to Las Vegas. Don't see anyone running up to testify. BPS, anyone on the phones in support?
Testify in support of AB 43. Please press star 9 now to take your place in the queue. There are no callers in support at this time.
Thank you very much. Then we will close testimony and support and move on to opposition. Anyone in Carson City in opposition to Bill AB 43? Don't see anyone. Anyone in Vegas? Don't see anyone. BPS, anyone on the phone lines now?
To testify in opposition to AB 43, please press star 9 now to take your place in the queue. Chair, there are no callers in opposition at this time.
Great. We will close testimony in opposition and open it to neutral. Anyone in Carson City in neutral on AB 43? And I don't see anyone in Vegas, and I'm guessing there's no one on the line. BPS, confirm.
If neutral testimony on AB 43, please press star 9 to take your place in the queue. Chair, there are no callers in neutral at this time.
All right, thank you. Did you want to come back up for closing remarks? Okay, with that, I will close the hearing on AB 43, our quickest one yet. Congratulations. Now we will have a presentation from the Nevada Health Service Corps. We will hear a presentation from Keith Clark, Director of Rural Programs with the Office of Rural Health, Office of Statewide Initiatives, School of Medicine, University of Nevada, Reno. Mr. Clark's presentation will offer an overview of this current state loan repayment plan. Please go ahead when ready.
Off to a good start. Hit that mic. Thank you so much, Chair Bilberry Axelrod, for inviting me to come and share this program. It's kind of, and to the rest of the Assembly Committee on Education, because this is where it all started. The Nevada State Loan Repayment Program, the Nevada Health Service Corps, was a combination of work between legislators and educators to address the areas of underservice in our state. So it's kind of exciting for me to be here with you right now, and I bring you greetings from rural and frontier Nevada. A little bit warmer here than in Elko, so that's kind of nice. But based on some of the emails that I've been getting and some confusion over the School of Medicine language in the original bill, the statute that I would like to just, I thought I ought to give just a very brief history lesson on how we developed this program. When what was then called the School of Medicine for the state of Nevada was instituted, the legislature gave it instructions that it was for the purpose of serving the underserved. It was for the purpose of being able to bring providers to rural and frontier areas of the state. And so right in our mission in 1969, when Governor Laxalt signed it, we were off to the races on that. That is what our mission's supposed to be. And I'm proud of the heritage of the faculty that has gone before me that have tried to keep that heritage alive, to really serve all of Nevada. And so some of these faculty members got together and when they were working in rural Nevada, and they said, we need to do more. And so they developed the State Office of Rural Health, and they are able to apply for a grant through the federal government. And they established the State Office of Rural Health to can focus on healthcare issues in rural and frontier Nevada. It's also supposed to be a focal point, so we don't have a bunch of repetition going on throughout the state. You know, every community trying to solve a problem, we try and bring those resources together. And one of those resources that we see that they saw that we needed badly is to get extra incentive for people to come to these underserved areas. You can educate them, but are you going to be able to keep them? Are you going to be able to have what it takes to keep them helping the underserved? And so once again, faculty worked with the School of Medicine worked with the legislature, and they came up with what was born here, the Nevada Health Service Corps, the State Loan Repayment Program. And with that, we will get to the slides. And this slide right here is it in the nutshell. This is what we were instructed to do in NRS 396899 to 396903. And if you wonder what it's about, you can always come back to this slide. The Nevada Health Service Corps was established by the Nevada State Legislature in 1989. It was created to address health workforce shortages in Nevada by offering student loan repayment in return for a service commitment. The statute requires the State Office of Rural Health to designate areas of underservice within the state and then match practitioners into those areas of need. But here's the interesting thing, is it's used to help both urban and rural underserved areas of the state. And that's an important thing to point out. And I'll show later on really how urban areas have received more places than the rural areas. But once again, there's a lot of reasons for that. And maybe during question answering I can go into that. But our mission statement is a healthy Nevada, and we're committed to the entire state. And the spirit of what we do is to help those that otherwise wouldn't be able to receive help. The instructions went on that we're to recruit practitioners for participation in the program, designate areas of Nevada in which a shortage of each type of practitioner exists, and then we're to match those practitioners with the designated areas. And then we help the practitioners negotiate contracts to serve in those designated areas of underservice. We were also instructed to apply for any matching money available for the program from the federal government. We were also instructed to adopt regulations, some rules, so the money is well spent. And we're supposed to receive and invest, disperse, and account for all money received from the federal government and any other source of income for the program, and be able to disperse it back out to the areas of need. As directed by the legislature, we were successful in obtaining matching funds from the federal government, and we were able to double the amount of money that we received by the state. And in fact, this is an ongoing process. This last year we were successful, actually the year before last we were successful in once again increasing the amount of federal funds that we were able to get. With those federal funds, we need state matching funds. That's a discussion for another day, but I just wanted to know that that is part of the program. But with federal funds, as you all are aware, come federal regulations. And so I'll share some of those regulations. One thing that I should point out, there is a National Health Service Corps, and we're kind of a country cousin of the National Health Service Corps because there is match. We strive to move quicker. We want to be we know that there's a problem in an area, we can respond faster than the federal government. And for example, one rural community isn't considered a health professional shortage area until it loses one provider, and all of a sudden it shoots up the charts. Well, by the time the federal government can respond to that, there's so many people that are looking for care and traveling hundreds and hundreds of miles trying to receive that care. So I'm the boots on the ground guy. I travel to all the rural areas, and some of the other hats that I wear for the Office of Rural Health, making sure that we understand what the needs are in those areas. With these federal funds, we can approve applications, depending on funding, for all of these different specialties. And the reason I bring out the National Health Service Corps too is one of the things that's different about us, because we have a dog in the fight, so to speak. We're paying some of this as state funds, so we're able to say, okay, we want registered nurses, pharmacists, alcohol and substance abuse counselors. We need help in these areas with our opioids, and we have to get that approved through the federal government, but we've been able to do that. So this is a very, as far as loan repayment goes, the Nevada Health Service Corps is very broad, but many will tell you it's sometimes not broad enough, but it's what we need to stick to in order to receive our federal funding. One thing that I should point out, this includes a lot of healthcare providers. I'd like to just contrast this by what it does not cover. And one of the important things, you will not see a specialist on this list, okay? This is for basic primary care needs, right? You will not see a hospitalist on this list. And last but not least, to my fellow faculty at the School of Medicine, you will not see faculty on this list. Sometimes I'll get a call and say, oh, this is from the School of Medicine. Good, I can get loan repayment. And the faculty call me up and go, are you willing to go work in underserved areas and put in the time? Then you can talk to me. But I can't help you otherwise. But that's one of the things I'm constantly orienting faculty about. And I also, with the University of Nevada, Las Vegas, their School of Medicine, we're so excited about them because that's going to bring more people, and we want them to be part of this program. And there's such great need out there. But it's not our school's program, it's the state's program. And so we invite them to come and work in areas of underservice, and so that we can provide them with loan repayment. One thing that I should point out, inasmuch as this was and she and the legislature working together, Nevada students are always given top priority, okay? We want to retain our Nevada students. 2 reasons: it's a return on investment to our taxpayers and our bosses, so to speak. And then it also works for retention. If we can retain the people that we educate in Nevada, I mean, if we can provide loan repayment, we will keep them much longer than someone that we bring in that isn't familiar with the state. Let's talk a little bit about the contractual obligation. In exchange for loan repayment funds, each candidate agrees to serve in their assigned community for a contractually specified period of time. Typically, that length is 2 years of full-time service for the initial contract. And so I've talked a little bit about the type of specialties or non-specialties that you need to be in order to receive loan repayment. Let's talk a little bit about the facilities, what you need to do as a facility to be able to qualify, and that's what this next slide is about. You need to be public and nonprofit, so it's not like a for-profit hospital can say, I'm going to be able to recruit and help my shareholders. It's not like that. You need to be nonprofit, public, or nonprofit, private entities located and providing health care services in a federally designated health professional shortage area. Sites must accept Medicare, Medicaid, and the Children's Health Insurance Program where applicable. They need to see all patients, and this is the kicker for a lot of them. You need to see all patients, regardless of their ability to pay. Eligible practice sites must charge for professional services at the usual, reasonable, and customary prevailing rates, except, of course, in free clinics. Eligible practice sites must provide discounts for individuals with limited incomes. So it's typically known as a sliding fee schedule. Now, with all those restrictions that might seem like restrictions, let's talk about some of the benefits. If you sign on to the program, you get a $50,000, up to a $50,000 payment towards your loans, and it's tax-free. We pay it up front, so hopefully hit at that interest rate, and then you're bound for those 2 years. What we're hoping, and what I tell the communities, is you've got 2 years for an interview and impress these people that they want to love your community and stay in your community. And I tell the same thing to the people. You have 2 years to get the community to love you. Now, let's see what we can do. And every time we get a re-up, it's a victory, and we do. 25,000. We've had several people from both community, from urban areas and rural areas that are now medical directors in those underserved areas that we paid off all of their loans. Let's talk about state funds only. One of the things when we went for federal funds, we wanted to make sure that we did not lose the flexibility granted to us by this legislature to be able to address areas of need in the state. So when we apply for those funds, we put right in there that we reserve the right for a state-only fund. Or if I can get some philanthropic organizations, which we have done before, that's provided match for this program, as well as just flat-out donations to underserved areas, then we have a lot more flexibility. We can determine. And this is some of the writing that I'd just like to share with you that is in that. It says, as determined by the State of Nevada Office of Rural Health candidates in fields listed, and other high-need professionals will be considered on a case-by-case basis into a program utilizing state, community, and philanthropic funding. The part of the program will not utilize federal match dollars unless the site qualifies. This flexibility allows the NHSC program to fill a need in an underserved community outside of the federal guidance. Let me give you an example. The extra state funds have been hard to come by. And in fact, during the Great Recession, we were down to one dentist. And it was a UNLV dentist that was serving the prison system. And then we got another dentist that was serving the women's prison, where it took 6 months for some of those ladies to be able to get out of pain. They had no dentist. And so we said, we're going to go with that one, because we just didn't have the matching funds. But we worked our way up, and we were able to get more of those federal funds. But what happens when you're in a community and there's plenty of doctors, but none of them accept Medicaid. On paper, it looks like you have no shortage, right? But that's the case in many parts of rural Nevada. It's also in the underserved areas of Nevada because there's such a demand for healthcare providers. Why put up with Medicaid? Why put up with Medicare when you can simply get reimbursed at a higher rate level from commercial insurance? So we have used the money, for example, in one rural community for a therapist, a physical therapist, occupational therapist, to be able to get people back to work, keep people from traveling hundreds of miles. We've done it for an OBGYN because there's, for example, in Elko, I believe it was 2019, we saw that over 40% of all our children were born in another state. So that's the minimum of a 250-mile ride for that mother. So we say, hey, health shortage or no health shortage, I think an OBGYN would be a good investment. Done the same thing with pediatricians. So those are the examples of what we've been able to do with state funds when federal dollars are not tied to it. And this last slide just kind of brings it all together. I hope when you're looking at your tablets, it's there so you can read it a little bit better. But as you can see, we have been able to place people throughout the state, Clark County being the largest recipient. But it's important to note, if you go all the way to the top of Nevada, I use this as an example oftentimes when it comes to mental health because people just don't have any idea. I lived in Las Vegas for a long time and I love Las Vegas. But I got Father of the Year for moving my kids to Elko, Nevada to teach them about being mission-oriented and helping the underserved. But I've got to tell you, the things that fly under the radar just blew me away. In fact, my wife that was into dental outreach that I couldn't believe she'd go, she wouldn't even go on a camping trip. And so she said, I would go if you would leave your job and go to Elko because these kids, the number one reason that they're going to the emergency room is dental pain, but yet there is not one dentist that will accept Medicaid. That was the number one reason, these little kids, so they're coming back. And it moved her enough. She's camping all the time now because we live in the country, and my daughters have started to forgive me, but actually it's been a great experience for a lot of them. So, because it's a wonderful place to live. But I wanted to bring that up. One of the challenges that we have going back to the mental health, we live there, but there's hardly anyone that lives there that doesn't know what it's like to put a loved one on a plane and then wonder, how are you going to get to Salt Lake City? How are we going to get to Reno? During COVID, it was even worse because we didn't have anyone that would accept our patients. And it was just terrible. There were suicides that were taking place. And we had some in our tribal communities. And we were talking, well, maybe we can get some help out of Las Vegas. We realized for this suicide cluster we were dealing with, that would mean, over 880-mile round trip to get mental health. And along with all the other challenges you have with mental health, you just couldn't get people to do that. But there are people that will do it. So I view it as a victory anytime we can get a psychiatrist, for example, to come to Nevada. Boy, I love it. And because it's serving all of Nevada. We're never going to get a psychiatrist in northern Nevada. You can drive from Sparks all the way to Salt Lake City before you see another psychiatrist. But if we can get psychiatrists that care about Nevada, that will do telemedicine, that will help these people, I still view it as a victory. So I bring that up because sometimes I'm been criticized the number of placements that we make in urban areas, but we're all part of the team, and it's all part of the mission. So when you go down and you see the FQHCs in the underserved urban areas of Las Vegas, there's a good chance that some of those physicians that you will see there, or some of those PAs, are part of the Nevada Health Service Corps. So I thank you very much for your time, and I'm glad to answer any questions.
Thank you very much for that presentation. It was very insightful. And thanks for doing the work you're doing.
You bet. We
Important
appreciate
stuff.
your support.
Yeah. Members, do we have any questions? Assemblywoman Mosca.
Thank you, Chair, and thank you for all that you do. I acknowledge and I understand that we're always working in our K-12 pipeline to make sure young people are both prepared and exposed to the medical education pipeline. But I did want to know some of the demographics of the people that are participating in the core, Pell eligible, first gen, as well as are we seeing we're growing our own, that young people from the rurals are then going back to their home, whether it's urban or rural, and participating?
Boy, I'm so grateful for that question. Chair Bilbray Axelrod, through Chair Bilbray Axelrod to Assemblywoman Mosca. Thank you very much. I will lose my train of thought by the time I get to her. So, once again, I wear a lot of hats, and so I got to stay focused on this, but pipeline is so important. We've got to get to these kids early. And then, but what's happened is there has been focus always. I'm going to use a rural metaphor here, even though I'm from Las Vegas. I've gone native here. You can't plant one thing and expect something else, right? You can't plant seeds and expect to grow a different plant. You can't go to a field and expect that you're going to harvest something that you never planted. But for a long time, that has been our strategy for bringing healthcare to Nevada. Let someone else plant it, water it, and everything. We can use loan repayment, right? We'll entice them to be there. So what we try and do, I know that, for example, in the audience is Andrea Gregg. She's also an AHEC director, Area Health Education Center director. We have 3 AHECs throughout the state, and we work on those pipeline projects to try and teach those kids. We got to get to them early. And especially in the rural areas, there's not a lot of opportunities as compared to my kids when they were in Las Vegas to have magnet schools, things like that, so that they compete and so that they can be accepted. But we put a high emphasis on that. We have now a program called the AHEC Scholars that teaches social determinants of health, that teaches cultural humility, and teaches how to work in a team-based care. And we recruit, like I'm over the frontier area, those children there, and trying to encourage them to go into the healthcare. It is so important that we harvest what we grow, even though the crop hasn't been very big. So we are monitoring that. I don't have those stats right together with us, but I will tell you at the School of Medicine, I've brought this up for years with them, trying to remind them this is why we were created. It was with the faith that we would do something for these underserved people. So I will tell you, I have seen leaps and bounds of being accepted. See, it's not just giving them loan repayment. We've got to prepare these students so that they can make it to medical school so that we can give them a loan repayment. It's not just standing at the end of the spigot. On the other hand, it is sad when I've seen us lose people that we've spent all this time and money educating to other states because we haven't been able to be nimble enough to provide them with what they need. We haven't been competitive enough as a state as far as our salaries that we offer and everything for mental health care workers, for example. We lose them. We lose some of them to other states. And I wish I had more information. I can get you more information on that, but I appreciate the question.
Yeah, so if you would get the demographic information and get it to our committee, and I will disperse it to our members. I know that's something that the University of Nevada, Las Vegas Medical School, that's part of when they're accepting students, it's that connection to Nevada and that willingness to stay in Nevada. So I'm glad we're doing that, because you're right. We got to grow them. We got to get them through the pipeline and grow them and keep them here. So thank you.
And we've got to go into those communities, because you're first generation. I'm a first generation. You don't know where to go, what to do. We've got to get in there, and that includes urban and rural. In Nevada, I'm happy to say the School of Medicine is like 25% now. Comes from these areas. So I know they're in the pipeline. I can tell you that.
We have a question from Assemblyman De Silva.
Thank you, Madam Chair, and thank you again for your great presentation. I have a question, and hopefully my colleague, my distinguished colleague here, Assemblyman Dr. Greg Koenig, appreciates this. He's been educating me a lot about this matter, and that is, has there been any considerations taking place for folks who are working within the eye care, practitioners of eye care, or is this something that falls underneath the state funds only added flexibility part of the program?
Yes. Under the state flexibility, if we were to receive that money, I got to do this for the record, Keith Clark. Thank you, Assemblyman De Silva. I've worked on that before in areas where there's no optometrist, there's no ophthalmologist, and we can do that under the state-only program, but it's not one of the accepted specialties from the federal program.
Thank you. Vice Chair Taylor?
Thank you, Madam Chair. And thank you for the report. I think all of us are concerned about how do we get more doctors to take care of our Nevadans. On that, thank you to my colleague, Assemblywoman Moscow, for asking about the demographics. Now, hopefully in that, it will let us know how many from Nevada within that, because that will be helpful as well. My question has to do with, you mentioned it before, the outreach. Can you talk a little bit about the outreach efforts, and specifically any of those that are intentional for our underrepresented groups, students of color, ELL, anything like that? Because those, as that population grows in our state, the more care providers we have, the better service we can give to those folks.
Yes, some of the outreach that we have done in the past as a AHEC organization, Area Health Education Center Director, has been to do.
I'm so sorry, just identify yourself.
I'm sorry. Okay. Thank you. Keith Clark, for the record, to Assemblywoman Taylor. We have done outreach as a group. I can tell you in Las Vegas, I've actually gone down to Las Vegas to help with these, where we've actually had doctors and people from the School of Medicine, including some of the, right when we opened the UNLV School of Medicine, to be able to get some of them to come over and work with these kids and do a day of discovery. Once again, my kudos to Andrea Gregg, who's here. I have been able to work with her. She's worked a lot in these areas in the outreach, and it's really neat. We've got to get kids excited about science, and so you'll have a summer camp, a summer of discovery, where you get the kids to come in and you have some mentors for them, and hopefully people from underserved, and we have been able to get that from underserved communities. One of the challenges that I have in rural Nevada, I've got to get some of those people all the way through medical school. We need mentors, and they're in the pipeline. We've got some in there, and I'm really excited about that. But we've done that where they can come in. I know that even my own children, I had them go to one of the Summer of Discoveries here. My daughter's been an intensive care nurse during the only intensive care nurse sometimes because of COVID, but it all started at a Summer of Discovery, going there and learning about science and learning all the neat things you can do with medicine. So that's some of it. I also work with medical students. One of the neat things that we do is a Spanish immersion program, Med 663, because the largest growing demographic in our state is the Hispanic population. And we saw terrible things happening during COVID. I would hear from nurses where they would just say, I can't even contact their family because I can't speak their language. And it tore them up. It really hurt those nurses, and I can't even talk to them. And one of the neat things about Med 663 is our medical students are going in and they're learning Spanish by immersion. And then what they do is they learn the cultural consistencies with it. It's all Hispanic. There's Guatemalan. We even have people that actually help with their dialect. If you're Guatemalan, if you're from another country, whatever, and then by the time they're through, their preceptors all speak in Spanish, and it's also that we need more of those role models when they can go back to their community and hopefully bring more of them. We also do the farm workers. We do a medical clinic that we go out to farm workers in Yarrington, Nevada. And these are migrant farm workers that otherwise might not get health care, and it's our students. But it exposes them and teaches them about different cultures, and hopefully cultures that they fall in love with.
Thank you, Director Clark. Oh, sorry. Thank you, Chair.
Thank you. We have a question from Assemblyman Koenig.
Thank you, Madam Chair. So, full disclosure, I am an optometrist, and I have 3 practices in rural Nevada. And even with those 3 practices, rural Nevada still is underserved. So I'm looking at and this is a question that you might not have the answer to, but I'm looking at the federally accepted specialties, and I see dentists, but I don't see eye doctors. We could have this discussion with the dentist for a while, but I feel eyes are more important than teeth. You can get dentures if your teeth go bad. If your eyes go bad, you need a cane and a dog. So any insight potentially why optometrists would be left off that list?
I get calls all the time from different specialists through the chair. What's that? I can say Keith Clark to Assemblyman Koenig. Thank you. I'm going to be doing this. I'll talk to my kids that way. For the record, I am your father. You know, I cannot qualified to be in the debate of what's more important, eyes or teeth. I know that someone that deals with people losing their eyesight, what an emotional thing that is, and people that can save that eyesight would be very important. It'd be great if we could open that up, but it is the federal regulations, and we have different boards from all over the country trying to get included on that and asking some of those same questions. Dentistry was one of the recent ones, but one of the arguments for dentistry was, well, I don't even want to get into the arguments for dentistry, so I'll just leave it at that.
Thank you.
Thank you for your service.
Thank you. And I think we are going to, it's always this side of the room. Assemblywoman Hanson.
Thank you, Chair. I'm sorry. She says this side, and then her and I always sit on this side when she's not chairing. So thank you so much. What do I call it, a wonderful presentation, even though there's a lot of heavy stuff in there. So a couple things. I near and dear to Elko County. I represent a small sliver of the western portion. I have 6 counties, 5 of which are rural. And recently, Senator Hansen and I took a visit and did a round of town halls in Humboldt County, and our wonderful colleague, Assemblywoman Chandra Summers-Armstrong, went with us to learn about some rural issues, and also Assemblywoman Mosca was there for some of it. When we left, one of the town halls that left us feeling the heaviest was access. We met with the hospital board and feeling this tremendous weight of the issues facing all of Nevada with access to care, but particularly in the rurals. So I'm really intrigued and encouraged that there's some incentives being offered. So I want to ask about maybe apprenticeships, what you're doing with some of those students in the rurals. I have a son who's a doctor from the University of Nevada, Reno. Luckily came back to Nevada, and 3 of my daughters are nurses. And when they did their apprenticeships, they did them at hospitals in the urban area, and then maybe could have a job afterwards. Are we doing that in this rural space where maybe nurses, even if they're at, doing nursing here in Reno or even in UNLV, are they having the opportunity to maybe go to the rurals, have an apprenticeship? Because sometimes, and I really think this is true, when people get exposure to the rural community and maybe what that pace is like, they might be attracted to going and staying. But if they've not been out there working in that community, if we're looking for an incentive, I really think sometimes the community could sell them on that. If they could kind of live there temporarily, work there, get to know the people, feel the pace. So just curious if that's part of the model that you're doing with rural health.
For the record, my mic turned off. For the record, Keith Clark. And thank you, Assemblywoman Hanson, for a very astute and important question. It gets back to what you were talking about, Assemblywoman Mosca, and that is exposure to the communities. And if we can't get someone from the community, the next best thing we can do is get people to fall in love with that community. So the University of Nevada, Reno School of Medicine, we have rotations. All of our medical students serve rotations in rural Nevada. And we have a residency. We actually developed the one in Winnemucca before it became part of UNLV, but we still keep close ties. But it's with that same idea. If you can get residencies, they can fall in love with that community. And hopefully the community, like I say, I tell them, you got an interview, you got to prove yourself worthy to keep them, and if we can work on that, that'll happen. But that is right. The statistics show the more that you're exposed to it, the more likely you are to help serve in underserved communities. So that's apprenticeships, we call them rotations, where they'll rotate out and practice in these areas. So we view it very importantly. And we don't only do it for our students. Under the AHEC, now I'm wearing my Area Health Education Center, we bring students in from all over, and we actually have housing that we will put them up in housing and everything so that they can get those rural experiences. And I also ought to mention, we have medical students right now that have been going to the tribal communities. And this gets back to what Assemblywoman Taylor was asking about. This is a real great one because I would love to get some physicians from our Native Americans. We need some role models there, and so our medical students have picked it up, and they've gone out there, and you're absolutely right. People will fall in love with the place, and it may not be, for example, Elko. They may work in Elko, but I've found jobs for them in White Pine County. I hope that answers your question.
Thank you very much, Mr. Clark, for the presentation, and I'm sure we'll continue to have robust conversations, and just very proud of the work that you're doing, and can tell that it's a passion project for you as well, which always makes my heart smile.
Well, I appreciate you. You don't get to see the people that you help, so my message is from them, and that is thank you.
Thank you. Okay, so members, we will now move on to the hearing on Assembly Bill 69. I'll open that up. This measure expands the loan repayment program administered by the Nevada Health Service Corp to include certain providers of behavioral health care. To present this measure, we have our former colleague from the Senate, Julia Ratty, who serves as board chair of the Washoe Regional Behavioral Health Policy Board, and Steve Schell, board vice chair, Washoe Regional Behavioral Health Board. Please go ahead when ready. I think you know what you're doing, Ms. Ratty. You've done this once or twice.
Thank you, Madam Chair. Did you all put the chair short as possibly could be specifically for me to be able to have this experience?
Ha ha.
Excuse me for just a second. My apologies, but if I'm going to multitask with the slides and be able to sit and be able to talk, I'm going to need a little help. Hello, everyone. My name is Julia Ratty. I am here today as the board chair for the Washoe County Regional Behavioral Health Policy Board, which is a role that I am honored to hold, and I'll let my colleague introduce himself.
Hello, everyone. My name is Steve Schell, and I am Vice Chair of the Washoe Regional Behavioral Health Policy Board, and also serve as Vice President of Behavioral Health for Renown Health.
So I would like to start with my gratitude to the chair for allowing a generous amount of time for this topic. We did think it would be very helpful for you to learn about the program that we are trying to expand before presenting our bill. So thank you for extending such a generous amount of time to Mr. Clark, and thank you to Mr. Clark for being willing to teach us about his program as we were starting to work on some of the behavioral health issues that are facing Nevadans.
So starting with this slide, Nevada is, once again, at the bottom of one of the lists we don't want to be at the bottom of. We are 51st among states and the District of Columbia in the overall mental health workforce availability and the prevalence of mental illness. According to the report, there's only one mental health professional for every 460 residents, which clearly is not enough to meet the need. It was bad before the pandemic, but I think many of you have seen the data, you've seen the statistics that we are continuing to be in a very elevated mental health crisis. What we're seeing in terms of substance abuse, domestic violence, mental health disorders is unfortunately off the charts. And so we weren't able to meet the need prior to the pandemic, but as we are coming still out of the pandemic, that has been exacerbated, and it's not great out there. Just as a quick reminder, there are 5 regional behavioral health boards. They were created in 2017. No, 2017, yep. Yeah, it was a great year. And they've gone through various iterations, but all 5 boards were created so that we could work at the regional level to identify behavioral health issues that were facing our communities, and then we were all given the gift of one BDR that we could bring forward some of those issues to the legislature to be addressed. Our board focuses on these prior areas: crisis response system implementation. Many of you heard from me quite a bit in the last legislative session about building out the crisis response system, workforce development, which is what we're here to talk to you about today, the cross-section between homelessness and behavioral health, children's mental health and crisis response specifically there, and diversity and equity within the behavioral health workforce. And then we partner with the Washoe County Health District on the behavioral health priority in the Community Health Improvement Plan. So again, just to hit the where we are a little bit harder, in 2023, the Mental Health America report ranked Nevada as 50th. 38% of individuals with any mental illness reporting not getting their treatment needs met. So that's a large number of people who have challenges and are not getting their needs met. Again, I think Mr. Clark did a nice job of talking about there are these things called mental health shortage, professional shortage areas that allow for certain federal programs to come in. When you're talking about mental health, 3 million Nevadas reside in a mental health professional shortage area. So that's pretty much everyone. There's lots of reasons that we have a shortage in our workforce. Certainly the COVID pandemic, we've seen some folks leave the field. We have these persistent workforce shortages across medicine, nursing, behavioral health. We are growing the number of licensed professionals, which is nice, but they are not keeping up with the population growth, and we are in a state that continues to demonstrate population growth. That workforce is aging, and we're not bringing in enough younger ones on the other end. There is a geographic maldistribution, love that word. They're not necessarily where we need them to be all the time. And then there's a diversity mismatch, which I think was brought up before, and particularly when you're talking about behavioral health, and a good part of that intervention is having a high level of comfort with the provider who's giving you treatment. Having the diversity within the workforce is a pressing need. I'm going to just pause here for a second before I jump into the slide and just try to connect the dots a little bit from Mr. Clark's presentation, because I want to make sure that you know about a couple of distinct things. So the local state dollars that Mr. Clark is referencing are dollars that have come through the legislature a number of times. For whatever reason, we just haven't been able to get them into the ongoing governor's budget. And so every year, that there needs to be an ask. And in past sessions, that was something that Senator Hardy would bring forward and advocate for. And I believe in the last session, it was $500,000. And so that money is not guaranteed. And that is a conversation that I believe will be happening someplace else in the building. It is not in our bill. Obviously not in his presentation, but just to flag that for you, that local flexible money is important to do all of the things that Mr. Clark talked about. In addition to that, we are bringing forward AB 69. So when our board decided that we wanted to work on workforce, we started talking to professionals like Steve Schell here, who's with one of our hospital systems. We talk to the universities. We participate in a statewide workforce, healthcare workforce shortage coalition that is run out of the Larson Institute. In that particular coalition, you had lots of great questions about pipeline. When we're talking about
Brady, I am so sorry. We just found out that your slides are not coming across on the internet. So if we could just hold on for 1 second, because
you're going to tell me to start over?
no, I won't make you start over. I just want to make sure that they were up until this slide.
Oh,
so yeah. So could just
Happy to
1
pause.
sec. Talk amongst yourselves. Oh, they're back. Okay.
Great. Thank you, Madam Chair. Again, Julia Ratty for the record. So we actually came in with the idea of creating more graduate medical education slots. Like, let's get more people coming out of the pipeline. For example, we were at a meeting where we heard that at the UNR School of Medicine, there are 6 psychiatrists that come out each year. And in that last class, only 1 of the 6 stayed in Nevada. And so part of the challenge is like, well, we're investing all this money on the front end, but we also need more slots. So we started there. And when we talked to the, mostly, I do need to say, we are the Washoe Board, so we're mostly talking to UNR. The challenge was when we spoke to them about wanting to have, let's expand the programs, basically most of them said to us, we can't recruit faculty. Because when you're talking about there's a shortage of behavioral health professionals, and those behavioral health professionals can go into all different kinds of settings, and then we're trying to recruit them to the university, we're in the same boat where we can't get enough of those behavioral health professionals to come and be faculty. And so we took a couple steps back and said, all right, well, maybe the first step then isn't expanding slots at our universities so that we can create more. Maybe we actually have to start with also solving the issue that we don't have the faculty. So we explored lots of different workforce initiatives. We completely agree with the concept that when we're talking about loan repayment, this is the last step, right? The pipeline starts, as you've discussed before, with 4th graders and 5th graders and 6th graders. But this program, Mr. Clark's programs are about, okay, now who do we actually have coming out of these programs and how do we get them to stay here? So, as Mr. Clark explained, they have to follow very strict federal guidelines with the federal dollars. Other states are being quite generous with their state programs, and that means that we don't compete, that they can recruit folks away from us because they are able to have more flexibility or to do more generous programs. There's not enough resources, so I think as you saw in Mr. Clark's presentation, right now, currently, there are 44 professionals statewide. We believe we need an infusion of behavioral health professionals now, and that whether that is retaining someone so that they don't get recruited away to another state, or whether that's a new provider, we need them now. We are in crisis now. And so what we're seeking to do is add money that specifically adds flexibility, but also is an infusion of 30 additional behavioral health specific slots. So that's the idea. And that money comes with more flexibility so that we can do a few things that the federal government doesn't do, faculty being a good example. So it expands the loan repayment program. We didn't feel like we needed to create something from scratch. You saw Mr. Clark, there's already a program, there's already passion. Why would we create something from scratch when they already know what they're doing? So it expands the Nevada Health Service Corps to include certain things. First thing is, this is the behavioral health list license. So psychologists, marriage and family therapists, social workers, alcohol, drug, and gambling counselors, and applied behavioral analysis. Now, some of those are already on the list for the federal program, but we wanted to make sure that they were on the list for our program as well. A licensed physician, physician assistant, or registered nurse that practices in psychiatry, addiction medicine, or another behavioral health specialty. So again, those medical professionals that have that mental health focus. Or, and this is in italics because we just missed this in the first draft of the bill, so this would be an amendment, licensed as a school psychologist or a school social worker. So the current federal program does not include school behavioral health professionals at all. And so we are expanding to include these particular individuals. The eligibility then is also based on the setting. And so the settings that we want to include are a hospital or other inpatient setting, an outpatient setting, or providing crisis management services. And so again, I alluded to, this legislative body has done a lot of work to set up a behavioral health crisis response continuum of care that includes a call center, mobile crisis teams that can come to you, crisis stabilization centers. Crisis stabilization setting is not included in the federal program as an approved setting. So we would very much want to add that because that's important work that we're doing here in the state. The NSHE setting is not included. So faculty currently cannot qualify for the program. We believe if we're going to build that pipeline, if there's a barrier to adding more slots is that we don't have enough faculty, then this would be a tool for recruiting faculty. And then again, the K-12 setting, and we also have an amendment there. We said K-12, but folks reminded us that it's actually pre-K-12. And so there's a mild amendment there to add the pre-K piece of it. So, and then same thing as with the federal legislation to make sure that we're targeted and reaching the populations that need it most. If they are in that first category where it's the behavioral health setting of hospital, inpatient, outpatient, or crisis management, they have to accept the certain forms of payment that are used by elderly or economically disadvantaged, otherwise known as Medicaid, Medicare, and CHIP, and they have to provide services to all patients regardless of ability to pay. We're asking for money. I heard there's a lot floating around. I'm hopeful. Yeah, I know. But the bill has an appropriation, and it's $1.5 million, and what that gets us is $50,000. That same, basically, we're mimicking the program that exists, and it gets us that additional 30 behavioral health professionals in that 2-year period. And so the way we envision this is as Mr. Clark and his team are doing this work to outreach to professionals to do all these placements and this matching to get these professionals where they are needed most, he can look at each individual applicant and say, oh, this is one I can use federal match money on. I'm going to take that out of the federal program. Oh, this is one that's in the school setting or in the crisis stabilization setting. I'm going to take it out of the local dollars so that he can be very strategic about which pot of money he's using based on the criteria. So with that, I'm going to turn it over to Mr. Shell now, who's going to, oh, I'm sorry, I just wanted to highlight there is that proposed amendment, 2 minor things, making sure we got the school mental health professionals in there and adding the pre-K. And then I want to turn it over to Mr. Shell to talk about what it's like to try to hire behavioral health professionals out there.
Hello again, Steve Shell for the record. So this slide demonstrates just a handful of the many statements and comments we have received regarding the challenge of finding a behavioral health professional to meet the needs of our community. There are many, many heartbreaking stories around our state. From law enforcement to public and private agencies and to individuals in crisis themselves, the message is the same. We need help. We cannot ignore the cries anymore, and we feel that this piece of legislation is a strong first step to move the dial in a positive direction. After opening and serving as CEO of Nevada's 2 newest behavioral health hospitals in Lassville Medicine, I see and hear the behavioral health workforce challenges every day in the emergency rooms, clinics, social service agencies, and schools of all levels, including the universities that have a limited number of faculty members to train and support our medical students, residents, and fellows. We have too many individuals in our state, including youth and adults, who cannot receive the mental health and/or addiction treatment they need due to a shortage of behavioral health professionals. Recruitment of these professionals has been a challenge in our state for many, many years. I have personally recruited and lost many, many out-of-state as well as in-state candidates to other states that have stronger loan repayment programs. These candidates were extremely interested in moving to Nevada, but subsequently chose other states that offered more incentives. Many graduates of our psychiatry residency and fellowship training programs at both UNR and UNLV and our social work, psychology, counseling, and nursing programs are also moving on to other states where they can receive more assistance with loan repayment as well. It cannot be stressed enough that the enhancement of our existing loan repayment program in Nevada will help us attract more behavioral health professionals and build a pipeline of providers who can treat the individuals not currently being able to receive the care they need. So we thank you for your attention and we welcome the floor to questions. Thank you.
Thank you, and I know we have at least 2 questions, so first I will go to Assemblywoman Anderson.
Thank you, Chair. Thank you for the presentation, and thank you for that help in making sure that the chair was a little bit shorter than the senator was used to. That was well done, Mr. Shaw. My question has to do with a little bit about what was kind of with the prior presentation as well. We don't want to make this into a laundry list of the different needs that we have, of which there are so many. However, there's also a need for our occupational therapists and our physical therapists, especially in our school settings. And I know that when Mr. Clark presented in slides 7 and 11, there was something along the lines of he does have that ability to sometimes allow some things outside of the federal list. Would that also still be included, or is it only for those items that are listed in particular for mental health help? Does that make sense? I hope.
Yes, I do. Thank you for the question. Julia Ratty for the record. Thank you, through you, Madam Chair. Thank you, Madam Chair. Thank you again, Assemblywoman Anderson. So we're the Regional Behavioral Health Board. And so we're here to ask you for loan repayment specifically for behavioral health professionals. There is an existing loan, so there are the 44 existing that are currently in. Those would still be the same situation that Mr. Clark is dealing with now. He's got to meet the federal requirements with the federal dollars, with any state dollars that this body chooses to give him. Then he can do other things. But this bill specifically is about and is limited to behavioral health professionals, because while there's a significant need across the board, we think that we were so far behind when it came to behavioral health in the first place that we need to do an infusion of energy around behavioral health specifically.
Follow up, if I may. I really appreciate the clarity of that, and also appreciate the fact that instead of trying to reinvent the wheel, you looked around our already existing programs in our state and decided to elevate them. So I just wanted to do a quick thank you. It was not a question. It was more of a thank you, and thank you for that clear answer. This is not open to other areas. This is for behavioral mental health. Greatly appreciate that clarity.
Thank you. Assemblywoman Torres.
Thank you, Chair, and thank you for the presentation. I think this bill is great, and I love the work that this program has done to help bring doctors to the state of Nevada. My question has to do with Section 6, subsection C. Specifically, it says that we can provide behavioral health care to pupils in grades, with the amendment in pre-K to grades 1 through 12 public schools. From past experience and lessons learned, we need to clarify too that what a public school is, and make sure that it includes traditional public schools as well as public charter schools. And even if we clarify it for the record, I will say from a bill that passed in 2019, I learned that it did not apply to public charter schools, and it definitely was intended to. So if that is the intent, I just think it should be made clear both on the record and hopefully in the bill.
Again, Julia Ratty for the record. Again, through you, Madam Chair, to Assemblywoman Torres. Thank you for the question. It's a great question. We shared our intent with the Legislative Council Bureau, and so I would defer to the Legislative Council Bureau, but that is our intent, all public schools.
Thank you, Madam Chair. Asher Killian, Committee Counsel. Yes, so since this language is being added to Title 34 of NRS, pursuant to NRS 385-007, which provides the definitions for that title, public school includes both traditional public schools, charter schools, and university schools for profoundly gifted pupils. So all of those types of schools would be included.
So while we have you with this hat on, can you also talk about what medical schools specifically?
Thank you, Madam Chair. Asher Killian, Committee Counsel. So when this program was originally created back in the 1980s, it was assigned to the Board of Regents to administer. So the Board of Regents decided where it would be housed. The most recent amendment to NRS 396-900 placed it with the University of Nevada School of Medicine. At the time, there was only one School of Medicine at the University of Nevada, and it happened to be located at the Reno campus. Currently, the University of Nevada has campuses both in Reno and Las Vegas, and both of those campuses have a medical school. So given that change and given the legislature's choice not to restrict this to a medical school located at a particular campus of the University of Nevada, it would be a decision for the Board of Regents as to which of the medical schools at the University of Nevada, or both, that would administer this program. My understanding is that they continue to assign it to the University of Nevada, Reno Medical School, but that would be ultimately a decision for the Board of Regents as to which of the medical schools or both would participate in administering this program.
Thank you for that clarification. Just wanted to get that on the record as well.
Madam Chair, may I ask a clarifying question on the clarification?
Sure.
When you refer to program, you mean the Nevada Health Service Corps and not just this bill, correct?
My apologies, Madam Chair. For the record, yes, Asher-Killian Committee Council, I'm referring to the Health Service Corps and not just this bill with that answer.
And that was Julie Ratty for the record. Committee, do we have other questions? All right, then we will let you sit back, and I will call for those who are here in support of Assembly Bill 69.
Good afternoon. My name is Shar Frost, for the record, and I am here today to speak in support of this bill. As the chair of the Clark Regional Behavioral Health Policy Board. As Ms. Ratty indicated, we were recently, made aware that only one psychiatrist out of the 6 who graduated from UNR had decided to stay in state. This is tremendously concerning for those of us who have experience in mental health and receiving those mental health services, but in addition to families of children who are receiving mental health services or are trying to access those services. One of the things I want to mention is the 2 years in Nevada. It took me 2 years to fall in love with Nevada, and I think that speaks volumes. I've been here for 26 years. I've raised both my children here, and I don't intend to ever leave. And I want to also mention the fact that the Surgeon General issued an advisory in late 2021, essentially saying that we are in a mental health crisis for children nationwide. The problem is we've been in a mental health crisis for children for upwards of 6 to 10 years. So from my lived experience, and I serve on my board, I am the chair, but I serve on the board as the person who has received behavioral health care services, including services for substance use disorders, or a family member of such a person. I qualify for both of those things. So I have received mental health care services here in Nevada, and I continue to, but navigating the systems in Nevada has been very difficult. But it's even more difficult when we cannot address the systemic disparities in care that exist for our BIPOC communities, for our Native American communities, and for our immigrant communities. And that is why we are supportive of this bill, because the more providers we can grow and keep here, the better off we will all be, and that will lead to that systemic change that we really need. Thank you.
Thank you, Ms. Frost. Nice to see you. Next.
Thank you, Madam Chair, and the rest of the committee. So my name is Dr. Lauren Chappell-Love. I am a licensed psychologist here in Nevada, practicing with a private practice down in the Las Vegas area. I wanted to thank you all again for the time and for talking about this topic that is very close to a lot of providers' hearts. So I'm going to attempt to keep it brief. I've been advised as a psychologist I speak far too much. So from that, I wanted to highlight a previously discussed statistic, just because I'm a psychology nerd for the record, that Nevada being 51st in the nation is my fancy way of saying dead last. These parity concerns are oftentimes exacerbated across the communities that we serve, in particular for doctoral providers such as myself. myself and other psychologists, and I think that we see this permeate, a ripple effect, if you will, through not only our youth populations, but also adults who just need services. This very much was exacerbated during whatever anyone considers to be the COVID-19 years. This is across both rural as well as frontier and more densely populated areas. And so to give you perhaps a bit of perspective about just the sheer need for psychologists in the state. So what are we doing to assist in this? How are we attempting to combat it? I think is a question that I was hoping to provide for the committee today. And many of us work multiple jobs. I do private practice. I work as a clinical director at a place that only provides Medicaid, and we're attempting to address the parity along a spectrum of what Nevadans can afford to pay and to be able to provide access to mental health care for more Nevadans. With that, wearing one of the hats that I wear, which is the president of the Nevada Psychological Association, which is the largest organization in the state for specifically psychologists. I would like to wish to extend support to AB 69 because it addresses mental health workforce shortages through the expansion of the student loan payment program. In that, it's helping to recruit and retain psychologists in the state. I believe that was also previously discussed. Some psychologists are like me and we move here because we're wanting to be here and to assist, and others are trained here, and we're trying to keep those younger doctors here as well, younger in the sense of not having trained and practiced as long. This is also going to benefit efforts to increase the diverse population and qualified population of psychologists, and that's just to better reflect the communities that we serve. Thank you for your time.
Thank you very much, Doctor. Next.
Hello. For the record, my name is, can you hear me okay? Dorothy Edwards, and I'm the Washoe Regional Behavioral Health Coordinator, and I have the pleasure of working with those two fine individuals that just spoke to you. Today I'm speaking in my role on behalf of Washoe County Human Services Agency, and would simply like to offer support for AB 69 as written and amended. Thank you for your time, and thank you for your service to Nevada.
Thank you very much. Next.
Good afternoon. For the record, Valerie Haskin, Rural Regional Behavioral Health Coordinator. As the unofficial staff for the Rural Regional Behavioral Health Policy Board, I'm here to represent them in offering their support for AB 69. The board has heard the bill and reviewed the bill and has not identified any negative impacts to the rural region or, from what we can tell, other areas, and really only sees benefit from this project. Thank you.
Thank you so much. Go ahead.
Thank you, Madam Chair and members of the committee. For the record, my name is Mary Przinski, here representing the Nevada Association of School Superintendents, an organization comprised of all 17 superintendents in the state, and we're very appreciative of this bill. And thank you, Senator Ratty, for your presentation and very clear thoughts on this, and the behavioral health professionals that this will bring to our schools are so needed, and we appreciate it. Thank you.
Thank you. Next.
Thank you, Madam Chair, members of the committee. For the record, Alejandro Rodriguez, Director of Government Relations for Nevada System of Higher Education, and she supports AB 69 and expanding this critical program for our state. Thank you.
Good afternoon, Chair and members of the committee. Blaine Osborne, President of Nevada Rural Hospital Partners, here in support of AB 69. NRHP is a consortium of the 13 critical access hospitals in the state of Nevada, and we also employ 2 of the 5 regional behavioral health coordinators in the state. Many of our member hospitals also benefit from the Nevada Health Service Corps, and we have supported that program since its inception. I appreciate Senator Ratty mentioning that there will be another BDR that you will see later in the session dealing with the original Nevada Health Service Corps program, but we are very happy to be here today in support of this expansion. I think you could tell from Mr. Clark's presentation that this really is the perfect program to expand, particularly for this critical need in the state of Nevada. Thank you.
Good afternoon, Madam Chair, members of the committee. My name is Megan Kamlasi. I'm the Associate Director of the Center for Public Health Excellence within the School of Public Health at UNR. And I am here today because part of our work at UNR is to lead a number of initiatives to improve the health of Nevadans statewide. And one of those initiatives is what's called the Nevada Healthcare Workforce and Pipeline Development Work Group, which former Senator Ratty mentioned. It's a group that aims to improve, grow, and diversify the public health, behavioral health, and primary care workforces in Nevada. It brings together more than 40 leaders from throughout the state, and they represent public health, behavioral health, primary care, K-12, higher education, minority health and equity, community-based organizations, and traditional workforce development. And the work group started because we realized there was a lot of great effort happening in terms of workforce development in Nevada, but it was happening in silos. And so it's an attempt to bring all of these sectors together to connect them and move the needle on workforce development. So over the past year, these diverse partners have met monthly. They've dug into these issues, done some information sharing, identified opportunities for cross-sector collaboration, mapped what exists in terms of healthcare workforce development for public health, behavioral health, and primary care, and identified gaps and plans to address those gaps. Our members have seen the impact of the severe behavioral health workforce shortage in Nevada. They've seen it in K-12 schools where children's needs are not always met. We have some members who are attorneys who work with the mental health court in Southern Nevada, and they were drawn to this effort because in working with vulnerable youth, they realized they weren't able to get the services they needed because there weren't enough behavioral health providers, and workforce was the issue. So not related to their job, other than they couldn't do their job because of this workforce shortage. And then we've heard a lot about the shortages in rural areas of the state. So essentially, the work group has identified expanding loan repayment for behavioral health professionals as a strategy to encourage behavioral health professionals to come to the state. It's discussed the same challenges that you heard today, challenges recruiting faculty to train the next generation of behavioral health providers, challenges getting providers in schools, whether social workers or other behavioral health providers, and this bill is a step in that direction and aligns with the plans the work group has developed. So thank you for your time.
Thank you. Go ahead.
Good afternoon, Madam Chair and members of the committee. My name is Sarah Adler with Silver State Government Relations, and today I'm proud to represent NAMI, which is the National Alliance on Mental Illness, NAPNA, I'm looking at the acronym thing here, NAPNA, which is the Nevada Advanced Practice Nurses Association, and very strongly to rural behavioral health and residential treatment providers, Vitality Unlimited and New Frontier. And they experience these workforce challenges continuously, and loan repayment would be such an incentive. So from all of my clients, they say, yes, please, bold, underline. And I want to give a shout out to LCB, because when I first heard about AB 69 and it was for behavioral health, I immediately went to Senator Ratty and said, is Chapter 641C in this bill, which is our alcohol and drug chapter, and it was. So you all define behavioral health to be inclusive of folks with addictions. So right on. Thank you very much.
Thank you. Go ahead.
Hi, good afternoon. I'm Andrea Gregg. For the record, I'm the CEO of High Sierra AHEC. And I won't belabor the fact that we are all aware that Nevada needs healthcare workforce infrastructure improvements across the board. On behalf of AB 69, I would like to share our thoughts on behalf of our agency in support of the expansion of the loan repayment program, as it certainly could serve as an invaluable means of expanding and diversifying workforce through incentivizing in-state education and practice. We know that through AB 69, Nevada's healthcare workforce would further reflect Nevada's diverse communities, which would then promote better health outcomes and enhanced access to care. Furthermore, behavioral health professionals that this bill would expand coverage for, such as those serving in our pre-K through 12 settings, really offer us an opportunity to provide the much-needed mental health support, counseling, and intervention services that our students so desperately need. Finally, in doing so, we know that the tuition repayment program for professionals that work in promoting mental and behavioral health for our students would also advocate not only for the pursuit of professionals in these areas, likely having an opportunity to recruit from within through those efforts, but certainly improve the health of our youth statewide and help with our infrastructure needs throughout the state. Thank you.
Thank you. And it looks like we have two people up at the ready to provide support testimony in Las Vegas. Is that correct?
Yeah.
That is correct. Thank you, Madam Chair. Good afternoon, Madam Chair and members of the committee. My name is Constance Brooks, Vice President at UNLV, and we'd like to thank the Washoe Regional Behavioral Health Policy Board and Ms. Ratty, the other leaders of the board, for pursuing this important legislation, which is to address a critical need as has been articulated by the previous speakers. We are in support of AB 69 as we are beneficiaries of this significant federal investment, with Clark County being the largest recipient, as was articulated by Mr. Clark, and we are grateful for his in-depth presentation. Like Nevada's rural areas, our urban communities suffer from health professional shortages, with the entirety of Clark County being designated as a health professional shortage area by the Federal Health Resources Services Administration. And so we believe that this legislation is significant in the sense of expanding to such that behavioral and mental health practitioners would be able to benefit from this program. And as someone with a social work background, I am particularly interested in seeing how this program can be expanded to address, as I've stated before, a critical need. But before turning it over to Dr. Khan, who is the Dean of the Kirk-Kerkorian School of Medicine at UNLV, I'd just like to state that this is one of many opportunities where you will see our two R1 institutions throughout this state working together to solve Nevada's challenges, and in particular, our two schools of medicine. And so we are proud to stand as a partner with UNR in this effort, and we appreciate the efforts thus far in terms of making sure that Southern Nevada is a beneficiary of this program, as has been stated. Thank you. Dr. Khan?
For the record, Mark Kahn, K-A-H-N. I'm the Dean of the Kirk-Kerkorian School of Medicine and Vice President for Health Affairs at UNLV. Again, we stand in support of AB 69. We think and believe and know that there's a mental health crisis nationally, but certainly in our state. Loan repayment is one of the best methods to get practitioners to stay in our state. My colleague, the dean at UNR, and I talk frequently, and as mentioned by my colleagues, Ms. Brooks, this is one of many areas where we stand together in support of this important legislation. Thank you.
Thank you very much, and I believe that's everyone in Las Vegas. Is that correct? Yeah. Okay.
That's correct.
Thank you. Okay, BPS, is there anyone on the phones who would like to offer testimony in support of AB 69?
Testify in support on AB 69. Please press star 9 now to take your place in the queue. Go ahead, caller.
Good afternoon. My name is Steve Messenger. That's Messinger, and I'm the Policy Director at the Nevada Primary Care Association. We represent the state's community health centers, also known as federally qualified health centers, or FQHCs. Our members provide integrated primary, behavioral, and dental health care to nearly 112,000 Nevadans in more than 60 clinics and mobile units statewide, as well as virtually throughout the state. AB 69 would greatly support our work. In just the past 5 years, FQHCs in Nevada have more than quadrupled the number of patients seen for mental health visits. The increase in demand is clear from 2016, when only 5% of patients accessed mental health services, to 2021, when this figure was 21%. That's 1 in 5, up from 1 in 20. Nevadans demand more mental and behavioral health services, and our health centers would like to meet this need. This legislature should be doing all it can to expand the number of available providers, and we believe AB 69 does just that. We urge your support. Thank you.
Thank you, caller. BPS, is there anyone else on the line?
Go ahead, caller.
Hi. Oh, can you hear me?
We can hear you.
I'm getting a message saying that I'm muted, but my name is Laura Hale, and I am retired from the state of Nevada, formerly worked with the primary care office, worked with Keith Clark and many others who have testified for you today and calling in support of AB 69. One thing that I wanted to mention, there was a question about retaining health providers in rural Nevada in particular. And when I worked for the primary care office, we did a number of surveys with physicians and other healthcare providers that we recruited through the National Health Service Corps and also through the J1 Physician Visa Waiver Program. And we would survey them about their experience. And one of the things that we often heard from rural Nevada was people there with their families had concerns about the systems in place with infrastructure, with schools and so forth, and just different services in those communities for their families. So I just wanted to let members know about that as an additional concern when trying to recruit and retain providers in rural Nevada. So thank you.
Thank you very much. BPS, do we have any other callers in support?
Hi, yes, can you hear me?
Yes, we can.
Great. Hi, this is Dr. Lisa Durrett. I am the interim chair for psychiatry and behavioral health at the Kirk School of Medicine at UNLV. And I wanted to speak in support of AB 69. As we all have heard, there's an enormous behavioral health crisis. And although we are graduating 10 general psychiatrists per year and 2 child psychiatrists per year out of our school, not all of them stay in Nevada, and it's been really difficult to recruit and retain graduates to serve as faculty. Our salaries at the school are certainly less than in the private sector, and one of the key factors to recruit and retain faculty is opportunities for loan repayment. It's also one of the reasons for which we can keep and retain psychiatrists, marriage and family therapists, and other professionals in our state. And so this would be an excellent way to not only achieve improvements in our workforce flow, but also because of the patient population that these individuals would serve, would improve access to care for our underserved populations. And so I very much appreciate your listening to all of our testimony and support for this bill. Thank you.
Thank you. BPS, next caller, if there is one.
Chair, there are no more callers in support this time.
Thank you very much. And with that, we will close testimony in support and move to testimony in opposition. Is there anyone here in Carson City who is in opposition? Okay. Las Vegas, doesn't look like there's anyone in opposition there. Is there anyone on the phone, BPS, in opposition of AB 69?
Chair, there are no callers in opposition at this time.
Thank you. We will close testimony in opposition and open it to neutral. Neutral testimony on AB 69 in Carson City. In Las Vegas. And BPS, is there anyone on the line for neutral testimony in AB 69?
Chair, there are no callers in neutral at this time.
Would you like to come back up? You sure you don't want to sit in the little chair? Well, thank you very much. So I will close the hearing on AB 69. Great job. I think we're all excited about it. And then I will bring us to our final thing, which is public comment. Reminder that callers and people coming up for public comment will have 2 minutes, and you can speak on anything which is within the purview of this committee.
Good afternoon, committee members. It's nice to see everybody. My name is Quentin Savoy. I come to you today in my capacity as president of the Las Vegas branch of the NAACP.
You might want to spell that name for us,
Of course,
Mr. Savoy.
Of course. Quentin. Savoy is S like Sam, A like Apple, V like Victor, WOIR. I come before you today It's not an agendized item, but civil rights have been violated. Last Thursday, 3 young black students at Durango High School were violently accosted by those we trust to protect our young people in schools. 2 of those young men have sustained injuries and have had to go to the hospital. And while this is not an agendized item, I think that no matter your political affiliations, we can all agree that our scholars and our teachers deserve to be safe in school. And that this video was released and went viral is not only traumatizing for the family and those young people, but it's a gross breach of trust within the community. So as an organizer and in partnership with several other community groups, we're asking and demanding accountability amongst the Clark County School District Police Department. We want a swift investigation. And while that may not be possible this time, something in that parameter is within the purview of this committee. We need answers for these parents. When I'm talking to the parents and they're explaining to me that their sons are crying on their laps and shoulders asking, why did they pick me? Was it because of the way I wear my hair? Is it because of what I was wearing? Let's go buy new clothes. This is traumatizing. And we've had a lot of conversation in this committee today about what it's going to take to keep our young people in Nevada to have a brighter Nevada. We can start by not traumatizing them. We can start by not treating them as perpetrators or egregious heathens. These young men left school to get food and were returning back to try out for track when this situation transpired that has left them afraid to go to school, afraid to walk home from school, so on and so on. So I just want to make this committee aware, because if there is something that can be done, we should absolutely be considering it. Because the first thing we should do to keep young Nevadans in Nevada is keep them safe at school. Thank you so much for your time, and I look forward to seeing you the rest of this session.
Thank you. And what I didn't say is that if there's anyone who wanted to make telephonic public comment, the meeting ID is on our agenda, which is posted to Nellis. So I'll give a minute to BPS to see if anyone is on the phone for public comment.
Mayor, the public line is open and working, but there are no callers at this time.
Thank you very much. Okay, so we are going to adjourn. I'll say our next meeting is Tuesday, February 21st at 1:30 p.m. That concludes our meeting for today, and this meeting is adjourned.